Recently, the American Medical Association CPT Advisory Board met to discuss how they're going to radically change how we look at remote patient monitoring. They met recently in May and discussed the possibility of changing requirements of billing codes. There are several billing codes that you have to bill for in order to get reimbursed for remote patient monitoring. One of those codes is for the need for patients to Here's the latest update with remote patient monitoring. If you run a program, you better be aware of these changes coming soon that could radically change how you view remote patient monitoring. Here's what you need to be aware of. That's right, if you run a remote patient monitoring program, there are talks that's going to radically change how you think about and bill remote patient monitoring in the future. Recently, the American Medical Association CPT Advisory Board met to discuss how they're going to radically change how we look at remote patient monitoring. So if you don't know me, my name is Theo Harvey. I'm the co-founder of SensorMed. We're a remote care program that helps thousands of practices across the country implement things like remote patient monitoring and chronic care management. We have done this for over 10 years and seen a lot of changes in the industry. But this proposal was something that even shocked us. They met recently in May and discussed the possibility of changing requirements of billing codes. There are several billing codes that you have to bill for in order to get reimbursed for remote patient monitoring. One of those codes is for the need for patients to submit readings up to 16 days in a calendar month. So that means if you don't have readings from your patient, and readings could be a blood pressure cuff, a glucometer, a scale, anything that's coming from your patient, you could run into the issue where you will not be getting paid for that because it's not meeting a requirement for the 16 or more days of readings. Well, there was a proposal that would say we're going to remove that requirement from 16 to 30 days down to 2 to 15. So that means if a patient gets on the scale maybe twice in a span of 30 days, that will be a reimbursable event according to Medicare. And these reimbursements are key because a lot of practices are seeing that a lot of times they're not getting their patients to engage more in that 16 days of readings. If you give a patient a blood pressure cuff, for instance, they may not use it the entire day of their program. They may not use it for even 5 days. But if you have a lower threshold so that you can collect data and make it reimbursable, you probably could have more practices engaged with remote patient monitoring. So that was a potential change that they discussed. The second one they discussed, there's a requirement that you have to have patient interaction up to 20 minutes in a calendar month. That means if you have a remote team that's calling patients, you have to spend at least 20 minutes of interactive time with that patient. That was a difficult process as well. Sometimes patients don't pick up the phone. Sometimes they ignore the call. Sometimes they are busy. What we found is that this is very difficult to achieve sometimes, but it's doable if you do a lot of things in process flows. But what they were proposing was actually going to lower the requirement from 20 minutes in calendar month to only 11 minutes. So that means 11 minutes will be a reimbursable event. This will radically change how RPM is delivered now. Obviously, there's a lot of times where you deliver the program, number one, don't qualify, don't pick up the phone, or don't use the devices. But now lowering the threshold, you're gonna see the opportunity for more and more patients to be engaged in these programs because the practices, medical practices, specialties who run these programs now will probably push more patients to these type of programs to get them involved in their care at home. Well, this is gonna be interesting if this proposal had went through. So what happened was they positioned it in May, but they tabled it. Obviously, the physician fee schedule, if you're not aware, the proposal gets sometime released around July timeframe. And then we know that they have a period of comment. So we're looking for July, August when they release the proposal for the physician fee schedule. If you don't know, that's basically the once a year process to understand exactly what CPT codes are being released, which ones are taken away, which ones are added or changed, so that doctors know what they're going to get reimbursed for the procedures that they do for the upcoming year. Next year will be in 2025. What's going to happen is they're looking at changing that drastically, right? And seeing what they can do with that. And what we saw is that a lot of these patients were struggling to stay on these programs. That's why this was a proposal that they put out there to say, hey, these are the patients that we want to ensure stay on these programs for a long time. If this proposal went through, that physician fee schedule would have included that in the process so that in 2025, you can now incorporate patients who only got 11 minutes of time with a nurse or a remote team, 2 to 15 days of data. And this has been radically changed, right? It will drastically change how we deliver RPM. But again, it's been postponed. So we don't know if it's going to officially go through. Just think about the ramifications. Why wouldn't CMS allow this to happen? Well, one of the things that we're seeing is obviously during the pandemic, there were a lot of RPM companies, a lot of chronic care management companies that just proliferated, right? And help a lot of practices help patients. But there were a lot that weren't doing things ethically. Sometimes they were crediting patients with getting devices that they shouldn't have got. They were shown that as meeting the qualifications for reimbursement, which isn't fair. So what's happening also is OIG, they're looking to crack down on what's being delivered at scale, right, for these patients. So basically, what does that mean? They're looking at understanding what's being reimbursed for RPM and making sure it really fits those standards for billing. OIG, the Office of Inspector General, is the organization that looks at excessive billing. One thing that's also on the rise, we see excessive billing with CGM devices, continuous glucose monitoring. A lot of DMEs, durable medical equipment manufacturers, are delivering these CGM devices for patients who may not have the need or have issues with diabetes. This has helped to maintain patients who have diabetes so they don't struggle with having to prick their finger every time because it's something that's a wearable device. What we're seeing is OIG is looking to crack down on excessively requiring patients to do that and being reimbursed for that. So this is something that OIG is looking at with CGM, which is also a form of remote patient monitoring, but they're also looking at the whole gambit from blood pressure to scales to seeing if there's excessive billing. So it's really important if you're looking to do these programs to make sure you adhere to the exact intent of that law to make sure you meet all the requirements so you can bill it correctly. But the important thing to know is that CMS and other board members are looking at, look, these programs are helpful. We're keeping patients out of the hospital. We're helping patients engage in their own health. We're slowing down the rate of chronic conditions, which unfortunately never go away, but they can be better managed. So there's hope that they're looking at helping patients do more of this more often. So we'll be looking more and more to see if these programs are going to change drastically in 2025. Obviously, that would drastically change how you deliver if you're already delivering RPM programs. But be on the lookout for things like this happening in the future because it's going to be amazing to see what's going to happen for RPM and chronic care management for the future now that we're kind of after the fact of the pandemic and the public health emergency. But we're really looking for solutions that really going to help patients. Obviously, I'm biased. I can tell you for a fact that this does work for the patient populations that we receive, especially underserved, underutilized areas like rural healthcare or certain patient populations. There's a dearth of physicians that are available that can meet their needs. And so a lot of times, a lot of these patients can only get help through remote sessions. And more importantly, it gives them awareness of what they're doing with their hypertension so they can control it better. A lot of times patients don't see the doctor but maybe once or twice a year, but having a program like this so they can continually get monitored and see things that's happening to their conditions, they're more aware, and more awareness brings action because now they know they need to change. So this is something we totally believe in and think that CMS should continue to invest in it and also not make the requirements so stiff because we want more patients on these programs. So the proof will be in the pudding. What do you think? If you're running a remote patient monitoring program now, are you seeing the benefits of it? Are you seeing obviously better patient care? Are you seeing the reimbursements come in? Do you want changes to the program, right, to make it more accessible to your patient populations? Is this something that you're very interested in as well? So if so, comment below and let us know what you think. Let us know how we can help, as we also can help you guide and think through this process with remote patient monitoring. As a matter of fact, we have several options for you. If you're interested in us getting to work, look in the show notes below. Click on a link and schedule time with us to discuss your needs on how we can help you remote patient monitoring because we believe we can get you to the next level or even navigate the changes that are coming. Definitely go check that out in the show notes and see how we can help you today. But in the future, check us out for the next video where we'll talk more about other areas that you can do to improve your medical practice and grow as you thrive in the new normal of healthcare.